Bismillahirrahmanirrahim. I'm Dr. Mohibullah Wazir. Today we discuss the diagnosis of the typhoid fever. Although typhoid fever salmonella bacteria was being isolated 132 years ago, but still typhoid fever is a threat and danger throughout the whole world, especially in developing countries like Pakistan. Every year, 11 to 21 million of people get typhoid fever in the whole world. And the danger and threat of typhoid is especially for the reason of the investigative processes and access to the proper and reliable investigations, especially in the poor countries. Then the routine test which is being done in our country and very commonly even in the teaching hospitals, these are the Typhoid and Vidal test. Typhoid was considered to be 97% specific and sensitive. But now, note, it is not like that. It is proved otherwise in all over the world by the people, by the doctors, after being experiencing it. Although it was blindly being faith by the doctor that if a GM in typhoid is positive, it means typhoid fever, but that is now not correct, it is now wrong. Now, both these tests, Typhoid and Vidal, these are being banned by NIH, National Institute of Health Laboratories of Pakistan, and the reason for that they give that both these tests gives false result in most of the cases, and then because of these false results and the belief of the doctors upon these tests, they give then immediate the treatment for typhoid, and the treatment is also being given recurrently, or secondly usually the treatment is then given incomplete, not complete treatment. That's why, because of the reason, the NIH spokesperson says that the MDR and XDR typhoid fever is increasing, and because of the reason for that, they have said the false report or the false results are of this both Typhoid and Vidal. Also from European countries, the report have come that in those countries the XDR typhoid report, that is extensive drug resistant typhoid, which is resistant to fluoroquinolones and third generation cephalosporin as well, they are being reported in European countries, and they considered that these patients are the people that have traveled to Pakistan and then have come from over there, and the XDR typhoid fever is being found in those people. And again, they give the reason for that the improper and recurrent treatment given as a result of the repeated false reports of the Typhoid and Vidal test. Now, the Vidal test is banned and discontinued decades ago, and I would think, and about the Vidal test, it is said that the rising titer of the Vidal is that is you do the Vidal today. If it is one by one, it is by it is by 180 positive. Tomorrow it should be 160, and so in this way, if increasing titer, then it will be considered as positive. My personal opinion that the Vidal test is now of no value in diagnosis except in very young children of 4 and 5 years. Of course, it may be of help, otherwise in other people, in all of the people, it comes to be positive and it is now of no value. And typhoid dart also be to be discouraged by the people because typhoid dart is also coming to be positive in people which purely suffering only from respiratory infection, and we have told to the patient that your typhoid dart IgM is positive, but I openly give you very with clear-minded the treatment of the normal routine treatment of the respiratory infection, and they get well. Because of this reason, then I my personal took this problem in the Ayub Medical College with the renowned physicians of our college. We discussed it a lot, and lastly it was to be decided that let us do the culture of these people in which the typhoid IgM is positive. So we did the culture of 14 people in which IgM was positive. It came only 2 people positive for salmonella, while 12 people they were negative for salmonella in blood culture. And note the point again that the negative typhoid dart has value, but the positive typhoid dart is doubtful. And the blood culture, it is again the mainstay in diagnosis of the typhoid fever. Now, in Karachi Civil Hospital, a study and being published in Pakistan Journal of Medical Sciences. In this journal, the study being carried out in Karachi Civil Hospital, somewhat 150 patients or a total 140 or 145 patients were included, some male, some female, and typhoid dart was being performed, and in this typhoid dart, out of 140, 47 patients came to be IgM positive. 7 patients came to be IgM, IgG, both positive, while 91 patients were both negative for IgM and IgG as well. Then the culture of these patients was being done, and it came to be only 15 patients were positive for Salmonella typhi and 7 patients present for Salmonella typhi, paratyphi, that is total 22 patients. Out of these patients is 47 patients, only 22 patients came to be positive. And the sensitivity of that was 26.7 and specificity 61.5 as compared to the normal, which was previously to be considered that it is 97% specific. Now, what to do? The end result that don't blindly don't believe only on typhoid dart and Vidal test. There should be very, keenly and very cleverly examined, and then the other tests which are being considered combination, and then to decide that whether the patient is typhoid or not, and then to treat. That this I will discuss in my next lecture. Thank you very much.